Good day, viewers and listeners. I am Godfrey Brooms, and we are again at the Ministry of Health for today's edition of the COVID-19 update. With the realization that children are being severely affected by COVID-19, we will be speaking with the Minister of Health, Dr. Frank Anthony, MP, on measures to protect the children, especially those with underlying medical issues. We're now with Minister Anthony. Minister, thank you for joining us once again. Starting today's program, Minister, with the realization that COVID is affecting children and they too must observe at least the basic COVID 19 protection measures, should children who have other medical condition, like asthma for example, wear a mask?
So, children should wear masks, and there are two sets of guidelines. You have the WHO guidelines that stipulates that children age 5 and above should wear a mask, and the CDC has put out guidelines to say that children 2 years and above should wear a mask. Now, wearing the mask can be different for children with medical conditions such as cancers and so forth. It is recommended that they wear the medical types of mask because it's trying to protect them from getting these infections. Other children who are relatively healthy should and can wear the cloth mask. So we should encourage children to wear masks, especially in the light that right now globally you have the Delta variant that is currently circulating, and with this particular variant, anyone who is unvaccinated would be at risk, which includes children. So globally, we're seeing a lot more children getting infected, and also because of those infections, they're being hospitalized. With the original strain of the original type of the virus, we would have seen that when children got infected, they had a milder form of the disease. But with these particular variants that are circulating, when children get infected, a small percentage of them can end up in the hospital.
So, Minister, alternatives to the mask like face shield would be better suited for these children?
Not necessarily, because face shield is just a physical barrier. When you wear a mask, especially those that, like the medical mask, they are specially designed. So depending on which type you're using, they probably would have 3 layers, and they're specially designed to prevent small particles from getting into your respiratory tract. With an N95 mask, it has about 5 layers, so it would protect you. So they're not the same thing, and therefore, if someone is, if you use a face shield and somebody sneezes, maybe it stops the physical droplet from getting to you. But if you're in a room where aerosols are circulating, you can breathe them in. So it's not the same thing.
Thanks, Minister. But should children wear a mask when playing a sport or doing physical activities?
If they're outdoor by themselves, then they can go without the mask. However, if they're with other children, then it is recommended that they should have a mask on, maybe a cloth mask. If they're going to be some distance from each other, then you can think about not using the mask. But I guess all these situations, we'll have to look at it on a case-by-case basis, and people would have to make judgments on whether that should be allowed or not. But generally, if you're by yourself, then there's probably no need for the mask.
Minister, and as usual, what is the current COVID-19 vaccination numbers?
Well, as of yesterday, we have 241,680 persons with their first dose vaccine. which would be 49.6% of our adult population. In terms of second dose, we are now at 126,000 persons, 620. So 620 persons who would have received their second dose vaccine. So this is now, would bring us to about 26% of our adult population who's now fully immunized.
Thank you very much, Minister. I'll now hand you over to Vishani Raghabir from the newsroom.
Okay.
Thank you and good morning. Minister, to start us off, we recently passed 500 COVID-19 deaths, and that also means that between about March 4th and now, we've had 300 COVID deaths. Could you definitively state whether this sort of surge in deaths has been caused by the emergence of variants?
Well, from a clinical perspective, we suspect that this is what is happening. For us to be definitive, we'll need to do gene sequencing to determine what were the variants that are circulating. But definitely, variants of concern, there have been many now. So we have seen in the UK the Alpha, now you have the latest one is the Delta. And right now in Peru, you have another one that has emerged called Lambda. Lambda, the latest one, is now maybe in about 26 countries. So as these variants emerge, when they become a variant of concern, that's because they're more transmissible. They cause severe disease, and they have the potential perhaps to evade the immune system. And that's why they become variants of concern. And we have a number of those that are circulating. Right now, while the Delta variant probably was first discovered in India, it is now the dominant variant in the US, and we have travel back and forth from the US on a daily basis. So one can assume that we have different types of variants that are circulating in Guyana and would have contributed to the clinical picture that we're seeing here. So not only did we have more deaths, we have seen more people being hospitalized during this period, and a percentage of them would have died. Again, all the persons who have passed away were not fully vaccinated. So we don't have anyone who has been fully vaccinated who would have died from COVID. So I think it's making a very good case why people should get their vaccination, because once you're fully vaccinated, you're more or less protected against the virus.
Earlier this year, we of course sent some samples to CARPA for genomic sequencing. Have we sent any additional samples to CARPA, ICANN, or anyone else for this sort of sequencing?
Well, right now, as I said to you, sending those samples for sequencing, it doesn't make much difference in terms of the way that we are treating patients. Treatment options remain the same, and we have to assume that we have those variants circulating. And therefore, if we're working on those assumptions, then we have to do, first of all, take the preventative measures, which would be the social distancing, mask wearing. A lot of people are still not wearing their mask properly. So if you have something hanging onto your face or under your neck, that's not going to protect you. And we see on a daily basis people are doing that. So it gives the appearance as if you're trying to protect yourself, but if you don't wear it correctly and consistently, you're not going to be protected. And unfortunately, we have a lot of that is happening. So the measures wouldn't change. They would have to be there. Mask wearing, social distancing, sanitizing, these are all measures that we have to put in place. And secondly, in terms of persons coming into the hospital, we have noticed the severity of the disease. So again, we have been working to make sure that we have medication to treat people if they get to that stage. And in treating people who are in hospital, there's a percentage that we'll lose. We know, for example, and this has been borne out by our statistics, that persons with comorbidities are going to have a harder time and would have a more severe form of the disease. And again, from the statistics that we do have, most of the persons who have died from COVID, apart from being unvaccinated, many of them also had comorbidities. So again, we assume that we have these variants based on people's travel and all of that. And the sequencing wouldn't make much of a difference in terms of understanding what we need to do. We still need to take those precautions. And once we do that, we can reduce transmission.
Just a quick follow-up. Does that mean that we won't be sequencing any samples?
We would try to do that, but again, it's not a priority because, as I said, we are assuming that all the different strains are circulating here.
Right. You mentioned comorbidities just now. I know the recent revelation that there are children in the ICU at the Ocean View Hospital was accompanied by a statement that said that the children had comorbidities. Would you be able to say what those comorbidities are?
I can't remember all of them, but certainly we had children there with cancer. We have currently in the ICU at the Ocean View, we have 10 patients as of today. Yesterday we had 11. We had one pediatric, I would say pediatric patient. In the medical terms, it's not considered pediatric because the person is 16 years old. So when I spoke yesterday, I was referring to that patient. Unfortunately, that patient succumbed. That patient had comorbidity. The patient had a form of cancer and unfortunately died over the last 24 hours. So here is a patient, relatively young, with a comorbidity and dying from COVID. As of today, we have 7 other children in the hospital. And again, we are monitoring these children. They are not in the ICU, they're in the regular wards. We are monitoring them. And this would have been an increase from yesterday. So I guess the point that was being made earlier that we need to take precautions with our children is very important because we assumed, and initially, because of the types of variants that were circulating, where children, if they got infected, would have generally gotten a mild form of the disease. That pattern is changing. And we're seeing that children now are being affected in a more adverse way. So over the last month or so, we have seen more hospitalization with children.
Toward the end of last year, there was a trend we were observing with younger persons and younger men are more susceptible to these severe symptoms associated with COVID-19. Now we're seeing children. And as you're saying that a lot of it has to do with comorbidities. What is the sort of ministry's plan to deal with comorbidities, but also comorbidities specifically in children?
Again, for now, the parents of these children would have to make sure that there's extra precautions that are taken. So, for example, if we know this child is vulnerable to a particular or at a high risk for a particular disease because of their comorbidity, then they should be wearing medical masks. That's one way of protecting yourself. And there are others that one can look at. The parents of these children should consult with the doctors who are treating these children to make sure that they have all the right measures in place. I think that's one way of dealing with it. We have seen from our statistics, since we start compiling them, that the more active part of our population, and this would be people between maybe 19 to say 30, we have seen a higher percentage of cases within this age group. Now, a lot of those patients or a lot of those persons who are infected, while younger, would have a very mild form of the disease. However, there are a few of them, and again, those with particular comorbidities who would have come into the hospital because of the combination of the two. But we have seen more cases within this age group. They are active, they're going out. As they interact with more people, their chances of contracting COVID is higher. And that is why it's important that this group particularly should get vaccinated. In terms of our vaccination, we are doing well with the higher age group. 60 and above, we are now more than 76% of those persons with first dose. But with this age group of, let's say, 19 to 30 or even 18 to 30, we are just about 43% on the first dose. So again, we need to get people to understand the importance of getting vaccinated, and not just with one dose, but get fully vaccinated.
Final question, Minister. There was a recent Facebook announcement from the advisor to the Ministry of Health about a quantity of Moderna vaccines being here. I was just wondering, could you say where those vaccines came from, and also how many vaccines were there?
So we have a group in the United States who donated 1,100 doses of Moderna vaccines. And when we received them, we offer it, first of all, to the healthcare workers in the system, those who have not been vaccinated as yet. Some of them accepted and got vaccinated. And then whatever remained, we give it out to the general public. So it's a small donation, and we have been able to use it all up. So basically, we have split the doses in two, because once you give the first dose, you have to give the second dose. So within a day, I think, we were able to give out all of the first dose. And so now those persons who received their first dose, they will get their second dose shortly.
And going into today's Mythbuster, Minister, can vitamin and mineral supplements cure COVID-19?
No. And the reason being is that vitamins and mineral supplements, they perhaps, I mean, as part of your nutrition, you need these things, micronutrients and so forth. But they help to improve your nutrition. It doesn't necessarily mean that it'll cure anything. Right now, there isn't a cure for COVID. So what we have is medication that would intervene at different points in the life cycle of the virus. And we have medication that, based on the disease that is triggered by the virus, to help to mitigate some of those reactions. So these medications can be broadly put in those two major categories. So those that would intervene trying to reduce the viral load would be things that are antiviral in nature, such as remdesivir, and those that would mitigate against the body's reaction are medications such as dexamethasone. So we have these, we have been using them, but vitamins and minerals would help perhaps with improving your general nutrition, but it doesn't cure COVID. To cure COVID, that's a different thing.
This has been the COVID-19 update. For more information, you can visit our website at dpi.gov.gy and our social media platforms. More information is also available at the Ministry's website at health.gov.gy. Join me and take up your responsibility in the fight against the COVID-19. Get vaccinated.